Today, we'll get a state of the pandemic update from Dr. Walensky. Dr. Fauci will highlight the latest science, and Dr. Murphy will provide an update on our outreach and education efforts. First, I want to provide a brief update on our accelerating vaccination program. As of today, overall, more than 112 million Americans have received at least one dose, and more than 66 million adult Americans are now fully vaccinated. That's more than 1/4 of all adult Americans that are now fully vaccinated. That's up from less than 1% when we came into office 11 weeks ago. This is significant progress, and as you can see in our weekly vaccination progress report, we're accelerating our number of daily shots in arms. Our current 7-day average is now 3 million vaccinations per day, up from 2.9 million last week. 3 million vaccinations per day, and this includes the lower volume days around the Easter holiday. And as the president announced on Tuesday, all adult Americans will be eligible for vaccination no later than April 19th. That's in 10 days and ahead of the original May 1 timeline. Our vaccination program is working. It's accelerating, and we're on track to meet the president's goal of administering 200 million shots in his first 100 days. This is only possible because of our whole of government response and the aggressive steps we have taken to get more vaccine supply, more vaccinators in the field, and more places for Americans to get vaccinated. However, we know there's more work to do. That's why we're accelerating our efforts to get more safe and trusted places for Americans to get vaccinated and meet the president's goal that by April 19th, 90% of Americans have a vaccine site within 5 miles of where they live. First, on the federal retail pharmacy program, as we expand to more pharmacies, millions of Americans are able to get their shot at their local pharmacy the same way they get their flu shot. Today, there are around 30,000 pharmacies participating in the program. That's an increase of over 70% in less than 2 weeks. And we are on track to meet the president's goal of nearly 40,000 local pharmacies by April 19th. Second, on federally run mass vaccination sites, our mass vaccination sites located in some of the most underserved neighborhoods in the nation are run and staffed by FEMA and DoD personnel in close partnership with state and local officials. And these sites have a combined capacity to administer 110,000 shots per day. On March 29th, the president challenged us to open at least a dozen new sites by April 19th. We've brought 9 online in the last 10 days. And today we're announcing 2 new sites in Tulsa, Oklahoma, and Baton Rouge, Louisiana. Third, we are making progress on meeting people where they are. More than 500 community health centers are already receiving vaccine directly from the federal government. These community health centers serve nearly 30 million Americans. 2/3 of community health center patients live at or below the poverty line, and 60% are racial and ethnic minorities. As we announced earlier this week, we're expanding our community health center vaccine program so that all of the nearly 1,400 community health centers can sign up to receive and administer vaccines. Overall, across the country, there are now more than 66,000 sites where Americans can go to get a shot. And by April 19th, we will meet the president's goal of ensuring 90% of Americans have a vaccination site within 5 miles of where they live. On vaccine supply, this week, a total of more than 28 million doses went out to states, tribes, and territories, and through the federal channels. More than enough supply to maintain and increase our current 7-day average of 3 million shots per day. In fact, over the past 3 weeks, we've allocated almost 90 million doses of Pfizer, Moderna, and Johnson & Johnson vaccine to states, tribes, and through the federal channels. And we're working with states, tribes, and territories and our other partners to make sure they are administering shots as efficiently and equitably as possible. Both Pfizer and Moderna are on track to meet their commitment of each delivering a total of 200 million doses by the end of May. And on Johnson & Johnson, the company is working closely with the FDA to resolve any manufacturing issues at the immersion facility in Baltimore and to secure FDA authorization. Johnson & Johnson is installing a new senior leadership team to oversee all aspects of production and manufacturing at the facility. And Johnson & Johnson will have full responsibility for the operation and will leverage the expertise of Merck as well. Johnson & Johnson expects a relatively low level of weekly dose delivery until the company secures FDA authorization. With FDA authorization, the company also expects a cadence of up to 8 million weekly doses in total across state and federal channels later in April. Importantly, Johnson & Johnson has also reiterated its commitment to provide at or near 100 million vaccine doses by the end of May. Now, even as we accelerate our vaccination program, we are seeing areas of the country where cases are increasing. From the beginning of the administration, we've been closely tracking the data on the state of the disease in each state and territory. The CDC tracks data and outbreaks at the state and county level. Since taking office, we've made this data public, and weekly state-by-state reports were made available for the first time. Our philosophy has been, see something, say something. So when we see metrics trending in the wrong direction, we talk regularly with state officials to offer our assistance, including deploying CDC teams to provide their expertise and resources. With recent increases in cases in some states, we're intensifying those efforts even further. We will be offering to states with significant increases in cases a set of additional tools to help them to stem the spread, including, first, working with states to make sure they are using all of the doses they have received. Today, millions of doses have been distributed, but have not yet been administered as shots in arms. Second, we're offering to surge federal personnel, including CDC response teams, FEMA, DOD, and other federal personnel to support vaccination efforts and get more shots in arms. Third, providing additional testing capacity, including increasing the availability of diagnostic testing, as well as screening in schools and other settings. And fourth, offering more therapeutics and treatments. All of this is on top of the more than threefold increase in vaccines that have gone to all states and jurisdictions since the president came into office. For a medium-sized state, this translates to hundreds of thousands of additional vaccines each and every week. And as is our practice, it's been our practice since the beginning, we make vaccines available to states as soon as they are available. In closing, to be clear, we're working to put this pandemic behind us as fast as we can. But as the president said earlier in the week, everyone needs to do their part. That's why he has called on every governor, mayor, and local leader to maintain or reinstate mask mandates. All of us need to keep up our guard and finish this job. So please, please wear a mask, socially distance, and get vaccinated when it's your turn. And with that, let me turn it over to Dr. Walensky. Dr. Walensky.
Thank you, Jeff, and good morning, everyone. I'm glad to be back with you today. We'll start again with an overview of the data. Yesterday, CDC reported 74,860 new cases of COVID-19, and CDC's most recent data show that the 7-day average of new cases is a little more than 64,000 per day, up about 2% from the prior 7-day period. Hospital admissions continue to also increase. The most recent 7-day average, about 5,300 admissions per day, is up about 7% from the previous 7-day period. And deaths have continued to decrease more than 20%, with a 7-day average now of 711. Vaccinations continue to increase, with the most recent 7-day average of nearly 3 million vaccinations delivered daily, up 4.5% from the prior 7-day period. Our vaccination efforts this week have continued to accelerate, moving us closer and closer to President Biden's goal of 200 million vaccinations in his first 100 days. Yesterday, we reached over 158 million. Earlier this week, I acknowledged the complexity of our current state in this pandemic. On the one hand, we have so much reason for optimism and hope, and more Americans are being vaccinated and protected from COVID-19. On the other hand, cases and emergency room visits are up, and as I've highlighted through the week, we are seeing these increases in younger adults, most of whom have not yet been vaccinated. On this graph are the national data showing the percent of emergency room visits for each age group that are for patients with confirmed COVID-19. As you can see, those 18 to 25 in orange, 26 to 54 in light blue, and 55 to 64 in green have increasing numbers of emergency department visits. Importantly, those aged 65 to 74 in yellow and those 74 and older in dark blue have decreasing numbers of emergency department visits, likely demonstrating the important impact of vaccination in protecting against disease requiring hospitalization. While those are national statistics, we should recognize that these trends are magnified in some regions of the country, like in the upper Midwest. CDC is working closely with public health officials in this region to understand what is driving these cases and how we can intervene. For example, in Michigan and Minnesota, there are also increasing number of cases linked to to B117 variants in various settings. And in both of these states, there is concern about transmission in youth sports, both club sports as well as sports affiliated in schools. While what is happening in Michigan and Minnesota is similar to what we are seeing across the country. Increasing reports of cases associated with youth sports. I want to be clear, as cases increase in the community, we expect that cases identified in schools will also increase. This is not necessarily indicative of school-based transmission. If fully implemented, the CDC's operational guidance for schools and community-level prevention measures can reduce or prevent transmission in schools. And we have not yet seen evidence of significant transmission of COVID-19 within schools when schools have fully implemented CDC's mitigation guidance. In addition to educator vaccination, which we spoke about on Wednesday, testing remains an important tool in our overall efforts to stop the spread of COVID-19, including in our schools. This week, CDC is awarding $10 billion through the American Rescue Plan to support COVID-19 testing in schools across the country. Being able to rapidly identify new cases among students will help us slow the spread of COVID-19 while we simultaneously work to expand equitable access to vaccines. With this funding for testing, every state will have access to millions of dollars to set up screening programs to add an additional layer of protection for schools, teachers, and students. This funding can be used to test teachers, staff, and students with any symptoms of COVID-19, those who may have been exposed to the virus, and to establish sustained screening programs across school systems. We recognize that establishing a testing program is a new venture for many schools. That's why CDC is committed to continue our work alongside state and local health departments by providing technical assistance and support to assist schools and states in standing up and implementing these programs. As these are rolled out, we strongly encourage parents, staff, and students to participate, to keep our children and our staff safe in school. These initiatives, alongside with strict adherence to public health prevention precautions and getting a COVID-19 vaccine, will help us turn the corner on this pandemic. With that, I'll turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do over the next few minutes is to answer a commonly asked question, namely, how could it be possible that you went from discovering a new virus in January of 2020 to approximately 11 months later to actually have a vaccine that goes into the arms of individuals in December of that same year, when we know generally vaccines take multiple years to develop. And this has often led to some degree of hesitancy on the part of people wanting to get vaccinated. So I'd like to answer that question. Yesterday, Science magazine published an editorial that I wrote, which tried to give an explanation of the story behind the vaccines. And the bottom line was that the speed and efficiency with which these highly efficacious vaccines were developed and their potential for saving millions of lives are due to an extraordinary multidisciplinary effort involving basic preclinical and clinical science that has been underway out of the spotlight for decades before the unfolding of the COVID-19 pandemic. Next slide. One can look at vaccine development in two major buckets: platforms and immunogen design. Next slide. With regard to a platform, what do we mean by that? Next slide. A platform is the type of vaccine that you use. There's genetic immunization, such as DNA and RNA, and hence the mRNA vaccines, viral vectors, such as the adeno with J&J, recombinant protein, such as Novavax, and a number of others shown on the right-hand part of the slide. Next slide. With regard to the mRNA vaccine, this work started a decade and a half ago when Caitlin Carrico and Drew Weissman were working on RNA and was able to modify the molecule to remove a key inflammatory component, which would have made use of this as a vaccine impossible. This rather transforming accomplishment of theirs led to the use of mRNA as a platform. Next slide. With regard to adenovirus, the Ad26 that's used by J&J, the NIH has been funding for decades a highly skilled and accomplished investigator, Dan Baruch, from Harvard Medical School, who have been working on this for a considerable period of time and demonstrated how immunogenic this particular vector would be.